Usually, the decision whether to test someone for those genetic factors would be based on their personal history. Have they ever had a blood clot? Did they have any bleeding or any blood clots during a pregnancy? Did they ever use oral contraception in their reproductive years? Was there any reason why they themselves would be at an increased risk of clotting? And then, of course, their family history. Did either of their parents or siblings or first-degree relatives have any blood clots? That would be an indication that that might be an individual that should be tested. But otherwise, it's not generally tested. Well, that's a huge topic, so I hope you have like 5 hours, maybe more. But anything that in mental health or psychiatry can really be related to OBGYN. I think what you're specifically getting at is that with the change in the menstrual cycle, with estrogen and progesterone levels fluctuating, there's definitely an effect on mood. And again, here's where every person is different, because for some women, the increase and decrease of estrogen doesn't make so much of a difference, but for others, it can be dramatic. So in the reproductive years, issues with premenstrual syndrome, premenstrual tension, premenstrual dysphoric disorder, all of these factors can be at play, and manipulating the menstrual cycle, sometimes going on a birth control pill or patch or ring, can be really helpful in that environment. Or then getting into pregnancy. Some women never felt better during pregnancy. Sometimes pregnancy is a sign when depression started. And of course, we all know about postpartum depression, where estrogen and progesterone levels plummet the first 3 days after delivery. Levels can go from up in the thousands down to less than 30. And so this is a time when postpartum depression is a very big issue. And so we have to be prepared for it and able to treat it. And then later in menopause, often the first presenting sign of menopause is a change in mood. Sometimes depression, other factors that are involved with the mental health profession. So we definitely rely on our friends in the psychiatric and psychologic worlds. I mean, for anything, I mean, I think the great thing about the care of menopausal women is that this is a field that's ever evolving, and as we said, it's a multi-specialty phenomenon. And what we want to do is keep women living longer, healthier, and more active. And so whatever we can do to take care of patients throughout this period of time, I think is effective. I think we could always use more help in any of these areas, but I think we're in a time where we're constantly doing new research, constantly investigating new ways of therapy. So yes and no.